also Senator Bobby Joe Champion's legislative assistant, and I'm also a St. Paul native, so I'm happy to be over on this side of the river. Yes. For this amazing panel today. So we're excited, of course, to have you all here, and also to all those that are streaming, and all these phones. I love it, love technology. Thank you everyone that's streaming here today, and we're here to talk about a very, very important topic today. What's at stake for women's health in this election? Be it reproductive freedom, economic opportunity, or the general assault on women's health care and what we're seeing in Washington. So there's a great deal at stake this November, as we know, right? Yeah. Right. So that's what we're here to talk about. So I'd like to welcome Cecile Richards. Of course, she's the former president of Planned Parenthood. And, of course, our Minnesota candidates, U.S. Senator Tina Smith. Of course, we have Andy Craig. And last but certainly not least, Ruth Richardson, everyone. All right, so we're going to go ahead and jump right into it, okay? So we're going to actually start down here with Ms. Richardson. And I want everyone give a brief introduction of who you are and then answer this question for us. What is at stake for women's health care this election cycle? We'll start it off easy.
Hi everyone, my name is Ruth Richardson and I'm running for State Representative in House District 52B, which includes Inver Grove Heights, Mendota Heights, Northern Egan, and Sunfish Lake. And I'm excited to be on this panel today with so many amazing trailblazers next to me. Well, when I think about what's at stake in this election, I always go back to the fact that politics are very personal. And it's oftentimes your personal experiences that really shape what your politics are. And when I think about women's health and reproductive justice and health equity, those things were really beginning to take shape when I was a child, based upon some things that I had seen and heard from my own family. When I was really young, my mom told me a story that has stayed with me and has really been a reason why I fight so hard for health equity. She grew up in the Deep South, very poor, in Mississippi. And when she was pregnant with my brother, she didn't have enough money to have a hospital birth, so she decided to give birth at home. Well, they ran into some pretty severe complications, and they almost lost their lives. Luckily, they did not. So a few years later, when she was pregnant with my older sister, she decided, we're going to save up, and we're going to have a hospital birth. And she told me about when she went into labor, she's in the hospital, the nurse is next to her and coaching her, and there are two doctors who are standing at the foot of her bed. And my sister's head started to crown. And the nurse looked at the doctor and said, "Doctor, the baby's coming, we need your help." And the doctor said, "We're not ready," and reached over and pushed my sister's head back into my mother. And my mom said that the pain was excruciating. It was a pain that she had never experienced before and not since. And she said that pain actually saved her life, because if she had been able to get off of the table, she was prepared to retaliate. And had she retaliated, there would have been consequences for that. And when she told me that, I thought, that's horrible. Like, what did they do to this doctor? And she said, I wasn't the only woman that happened to. That was a standard practice that was happening to African American women in Mississippi by their providers. It had happened not only to her, but to several of her sisters as well. And with her older sister, the results were even worse because her baby died. And so when you fast forward to another generation and the fact that I have experienced barriers in terms of accessing care, and I've experienced implicit bias when I've attempted to access care, and I think about a family member that we lost just last year who died during childbirth, I know that we're not there yet when we're thinking about health equity, and there's still so much that needs to be done. And I also know that because there's so much that needs to be done, we cannot go backwards. we cannot. And so when we talk about what's at stake for women, what's at stake is our lives. And I'm prepared to go to the State House to ensure that we are moving forward with health equity.
Thank you so much. My name is Angie Craig, and I'm the woman who's going to make Jason Lewis a one-term congressman. As I think about this question, there is nothing more and nothing less than our lives at stake in this election. And I, for one, am really tired of politicians in Washington playing politics with all of our lives, and especially with women's health care in this country. Like Ruth, I know from my personal upbringing that if you can't afford health care, it's not available to you. And we have not done enough in this country to make sure that health care, quality, affordable health care, is available to every family. I still remember the bills that piled up during the time in which my own family didn't have access to health insurance. I still remember my mother having to decide whether she was going to allow her children to go to the dentist or not when there was a toothache. We should not, women of this country should not have to make those choices. And over the last almost decade now, and especially in the last 18 months, congressional Republicans have been chipping away at the progress we have made in this country. Voting for a bill, Jason Lewis, the American Health Care Act, that would have thrown over 20 million Americans off their health care and gutted, absolutely gutted, pre-existing condition protections in this country. You are sitting right now in a congressional district for which for non-elderly citizens, 51% of our residents have a pre-existing condition. And I, for one, am not going to allow this Congress or this administration to gut pre-existing protections in this country for anyone. Now, we have an awful lot of work left to do because today's health care laws are not perfect. We have got to stop playing politics with people's lives. We've got to step up and fix the things that aren't working. We've got to step up to make sure that quality, affordable health care is available to everybody. Thank you.
Good afternoon, everyone. I am U.S. Senator Tina Smith. I am your United States. I came to this position having starting out working in the private sector. I started my own little business, and then I worked at a wonderful organization called Planned Parenthood. And when I worked at Planned Parenthood, that's really when I started to understand so fully how if women have access to health care, they have access to reproductive health care, then they have the freedom to decide for themselves what their lives are going to be like. And without that, they don't have that freedom. They don't have the chance to decide for themselves what kind of life they want to live. That work that I was able to do next to an incredibly dedicated, strong group of individuals, physicians, nurses, volunteers, to make sure that women and men had access to high-quality, confidential health care shapes my understanding of how important health care is to families to this day. When I became senator, my office and I traveled all over the state. We have visited every single one of Minnesota's 87 counties since I've been senator. And the number one issue that people talk to me about is health care, and especially their worries about how they're going to pay for health care. Too many people in this state and in this country are having to choose between paying for the health care that they need and buying groceries or paying rent. It is fundamentally wrong. And this is why the very first bill that I introduced as a senator was a bill to crack down on this practice that the big drug companies have of paying to keep lower cost generic drugs off the market, which costs all of us more money and puts more money in the pockets of big drug companies. I've worked on bills, I'm sponsoring bills that would allow Medicare to negotiate directly with the big drug companies for lower prices, just like we do with the Veterans Administration. This is not something that is radical, it is something that just makes common sense. I am strongly opposed to the efforts of this administration and the Republicans in Congress to roll back the basic consumer protections that are in the Affordable Care Act. Like, why should insurance companies be allowed to discriminate against people because they have a pre-existing condition like diabetes or cancer? Why should insurance companies be allowed to discriminate against somebody because they're older? These are the protections that we built into the Affordable Care Act that my opponent and many others on the Republican Party want to tear down. Let me say one other thing about healthcare that I have come to appreciate is so important. Healthcare means all of our health. It means our physical health as well as our mental health. It is wrong that too many people can't get access to the basic mental health care that they need to live productive lives. I'm working on a piece of legislation. In fact, it just passed the Senate with Lisa Murkowski, a Republican from Alaska, to expand mental health care services in our schools. That bill passed as part of the big, the opioid package that just passed the Senate at the beginning of last week, and we're now working it out with the House, and I hope that we'll be able to get this bill signed into law. It includes many, many provisions that will help women's health, will help families' health, will help children, and will help with mental health for our kids. These are some of the things that I'm really looking forward to talking with all of you about, and it gets to this core idea that if you have healthcare should not be a privilege in this country. It should be an expectation and a right. And I will do everything I
can. Well, thank you, Senator. It's such an honor to get to be here with these amazing women. And so thank you, Angie. I can't wait to have you in Washington. We need you. I feel like this year is going to be like the cavalry arriving, finally, and Ruth as well. So I'll just add a couple of things. I come to this from the perspective of someone who worked for an organization for the last 12 years, Planned Parenthood, that is a healthcare provider to millions of people in America. And we're very proud to finally have a United States Senator who actually was a Planned Parenthood employee and leader, Tina Smith. So I'm really excited about having her in the Senate so that we don't have to actually explain what women's reproductive health care is about everybody in Washington. But it is really important to kind of boil down, because I think the complexity of of all the issues that we hear about, but there are a few core things that have happened under the Affordable Care Act that have been critical to women's health care and therefore to families' health and to communities' health. Many of you remember in the fight to pass the Affordable Care Act, there was a lot of give and take, but three things happened to me that really are so critical to remember, remind people about, and to always protect. One was finally, for the first time in our lives, insurance companies are no longer able to charge women more for the same health care they provide men. No more This is a fundamental economic issue that has affected millions and millions of women. The second thing is we got, finally, as has been talked about, protection on pre-existing conditions. Now, the fact that the insurance companies could no longer block folks from getting health care that had pre-existing conditions isn't that it overwhelmingly had been disadvantageous to women. Women were prevented from getting health care coverage because they had been the survivor of sexual assault or domestic violence. They'd been denied coverage because they had had a cesarean section or had been pregnant or were pregnant. On and on and on and on. This is something we cannot let go of. It absolutely has affected the ability of women to get health care coverage in this country. We can't get it. And the last thing that is near and dear to my heart is we got preventive coverage for women under the Women's Health Care Plan. And one of the biggest fights we had was over birth control. And it wasn't until the very day that the bill was signed, we actually finally got the agreement that women's preventive benefits would be covered. And in fact, now more than 60 million women in this country get birth control at no copay. All right? And this is and I say that because it's actually at risk, and we can talk more about what Trump Care meant, but of course it was to completely undermine all the protections we got under the Affordable Care Act, particularly those protections for women. There was even really in the last iteration of Trump Care, they were going to get rid of the protections for maternity care for women. That's what's at stake. And as many of you know, we spent the last 2 years fighting the effort to defund Planned Parenthood. We only won that by 1 vote in the United States Senate. That is, if no other reason, that's why we have to have Tina Smith coming back to I'll close with this, because I think it's not just about economics, although I'm really glad that Tina talked about the economic burden that folks face in this country, in the inability to get affordable health care. Because of the work we've done on preventive care, and Planned Parenthood was in the lead, but there are many other folks who are involved in this. Because of that, because of more women being able to get access to affordable family planning and the best kind of family planning, we are now at the lowest rate of teenage pregnancy that we have ever seen in the history of the country. And so, to Angie's point, I think it's, and to Tina's point, is when a young woman can actually get the health care that she needs, get the access to family planning that she needs. That means she can finish school if she wants, that means she can go on to higher education if she wants, and that means she can decide when and whether she has children, one of those fundamental rights that we have to protect in the United States. So, thanks for having me.
Thank you so much. All right, so let's get into some of your questions. How much danger is Roe versus Wade today? And we'll start down here with Ruth.
I think everyone has been watching, holding their breath to see what's going to happen with the Kavanaugh hearings, because there is great fear that if he is on the Supreme Court, that will spell the end of Roe versus Wade. And so when we're thinking about it again from the perspective of what's at stake, basically that means our liberties, our rights to choose, our right to self-autonomy is at stake if he is on the Supreme Court. So it is in grave danger, in my opinion.
Yes. We already see in states around this country that have very restrictive reproductive rights, just the enormous burden that puts on communities and people of color. And look, this is a national crisis point that we're at. The thing that I look at, obviously the senator's about to tell you absolutely hell no to her vote, I'm sure. But as we think about just as a nation, women's reproductive rights and the direction we want to head as a country, it is imperative that we stand up together. And the reason I'm so optimistic about the midterm election is predominantly because we have seen so many individuals, not just women, but a whole lot of women, off the sidelines this cycle and get involved in politics in a way that we haven't seen. And it is, devastating, obviously, that we're on the precipice of this being such a pivotal moment in this country, but we have to fight back, and I know we will.
Thank you, Angie and Ruth. And first, I want to just be clear that I will vote no on Judge Kavanaugh. I can tell by looking at his record of the decisions that he has made that I disagree with him. I think he is wrong. I think his decisions are wrong on a whole range of issues that matter to Minnesotans. Issues around voting rights.
Yep.
He has he has written decisions that undermine the Voting Rights Act of 1965, issues on environmental rules, and issues on women's health and the capacity to keep Roe versus Wade in place. And Judge Kavanaugh, in his answers to the questions in front of the Judiciary Committee, was, he said that Roe was settled law, but yet this Supreme Court has demonstrated its willingness to overturn settled law. We saw this in its willingness to overturn significant protections for organized labor, which they just did with the Janus decision not that long ago. So fundamentally, this is why I'm opposing Judge Kavanaugh. And I want to also just remind us that the Supreme Court is so vitally important to our democracy, and it is an institution that is supposed to be above party politics. The tradition of Supreme Court nominees was that they would be confirmed by the Senate with 90, 95, 100 votes. We're celebrating, I think today, the anniversary of Justice Sandra Day O'Connor being appointed to the Supreme Court, who was confirmed with 100 votes. Ruth Bader Ginsburg was confirmed, I think, with 97 votes. This is how the Supreme Court is supposed to work. And that is why I'm so deeply concerned about this approach that this administration is taking, selecting Supreme Court nominees off of this list put together by highly partisan and ideological groups, and a president who has told us straight out that he's only going to appoint people to the Supreme Court who he knows would overturn Roe versus Wade. I'm eager to hear what Cecile has to say about this, because I have a feeling you have a point of view on this. And I think it's really important, because maybe Cecile will talk a little bit about how there's the danger of overturning Roe, but there's also the even maybe greater danger of chipping away at Roe in such a way that women, especially women who don't have a lot of economic needs, have lost their access to begin with.
Well, thank you, Senator. And I absolutely, agree with all the comments that have been made. Look, I think I want to say one thing about Judge Kavanaugh. Yes, it's true that the president has said he will only appoint judges that will overturn Roe versus Wade, and so I think we just fundamentally know where he stands. But in addition to some other really horrific decisions, which I agree with you on, he actually went out of his way as a judge to try to block a young immigrant woman in Texas who had complied with the very onerous restrictions there are to even access safe and legal abortion as a minor. He tried to delay or block her access to safe and legal abortion. One of the most heartless acts that we've seen from this administration, and I think that kind of goes to the core of the question, which is whether or not Roe versus Wade itself as a decision is literally overturned. What this Supreme Court is poised to do is to absolutely eviscerate all the protections that it has, and that the impact, as always, will be on young women, women with low incomes, women of color in this country. We know that abortion existed before Roe versus Wade, right? It was simply unsafe and it was illegal, and young, healthy women died routinely in emergency rooms across this country. You can still meet doctors who remember those days, and we cannot go back there. We can never go back there in this country. But I do think it's important to remember, and I come from the state of Texas where we have some of the worst restrictions. There are so many cases and the circuit level that are poised to go to the Supreme Court, cases on abortion, on laws that have passed that are unconstitutional on the face of it, but with a different balance in the Supreme Court. It's only going to take one vote difference. Those kinds of laws will be enacted. And so I think this is a critical moment. And as Senator Smith said, the United States Senate has to confirm the Supreme Court. That's why this election, changing the makeup in Washington of the United States Supreme Court, as well as U.S. Congress, is absolutely critical to the future health and well-being of every single woman in this country.
Thank you. Next question is, What is the greatest threat to reproductive rights and LGBTQ health access, and how will you address it?
So as I've been out campaigning, some of the issues that I've heard from the LGBTQ community and related to access to health care is some of the challenges that have been encountered by those who are maybe in the process of transitioning. And if they're in the process of transitioning, they've struggled to find health care that would allow them not only to transition, but to also get the preventative health care that they need for things, to address things like diabetes, for example. And so really understanding that when we're thinking about healthcare being a right in our country, something that you're born into, and unfortunately, not everyone thinks that way. I've been at doors where people have told me, I believe you need to earn healthcare. And if you earn it, then you are able to take care of it. My perspective is when you're born, you have earned your right to have healthcare. And with that, it's ensuring that when you have not only access to health care, but you actually have coverage that you can use. I hear from so many people who have a health insurance card, but they don't actually have doctors who are willing to take that, or they're not able to get the preventative care that they need. And we know that when people have access to preventative care, it not only saves us money, but it also saves people's lives.
This is an incredibly important issue, and in fact, even with private employer-sponsored health plans, often the services that are required, especially in the transgender community, aren't covered under health care, that final surgical transition. And what most even private companies don't understand, and we went through this at a company that I happen to lead, HR for a number of years, in that, look, a person who needs health services is using most of those services anyway. And it adds just pennies on the dollar. You think about the mental health requirements required before someone makes that final surgical transition decision in this country. And so, to me, this is an area where we even have work to do in the private insurance marketplace today to make sure that we're providing equitable coverage across all segments of the LGBTQ community.
So I know that everybody up here is of the mind that healthcare should be a right and not a privilege. And the question is, how do we actualize that? How do we make that work in the world? There are a few things that I think we should do. There are a few, they seem like small things, but they are not small things. First of all, I completely oppose the efforts of this administration to defund Planned Parenthood, to make Planned Parenthood not eligible for, just think about this, many of the people who are looking to get health care have public insurance, and if Planned Parenthood isn't allowed to take care of those people, their people are not going to have a place to go. To what Angie is talking about half of the people in the country and in this state get their health insurance from private employers. Those private employers, in my mind, ought not to be able to opt out of covering basic reproductive health care from Americans. That to me is just, I think that's wrong, and it's wrong-headed. It ends up not saving us any money, and it is inequitable. It is not just. But I also just want to say that I think we need to think broadly also about what we do to fix our broken healthcare system, where we pay more than any other country in the industrialized world, and we actually get, in many cases, lower quality than most other places in the industrialized world. And we have to try to solve that problem and get to the bottom of that. I believe that I signed on to bills, and I would promote bills that would allow everybody to be able to opt in to Medicare or Medicaid as a way of making sure that health insurance can be broadly achieved by everybody. I think that would be an important step. And I think we just have to get our minds around the idea that nobody ought to be able to be, we shouldn't allow people to be discriminated against because of who they are when it comes to the basic health care that we all should have, we all should be able to have.
Oh my God, there's just so many reasons we need you in Washington, D.C., so I just have to say that. But look, and I'm glad that the Senator raised the issue of defunding of Planned Parenthood, because I actually just want to say one thing about this, because that word defunding is used as sort of a catch-all, but actually, I think it's important to understand, Planned Parenthood isn't actually in the federal budget, right? I mean, that would be lovely if we had a big line item just to provide health care, which we do, affordably and accessibly. But in fact, what this administration is trying to do, and the Republican leadership in Congress is trying to do, is say to folks, if you use public health care, you cannot choose the health care provider that you want to go to if that's Planned Parenthood. It's basically to try to target one health care provider that happens to be the biggest provider of reproductive health care in the country and say, folks can't go there anymore. So that's actually what defunding is about. It's actually about blocking access to reproductive health care. And that is important, particularly when you think about how hard it is in a lot of areas of this country to go someplace to get sexual and reproductive health care where you're not stigmatized, you're not judged, and that is particularly true for the LGBTQ community. I know my home state of Texas, it can be a very unfriendly place. And I'll just give you one clear example why protecting access to Planned Parenthood is so important. We recently opened services in East Texas, which is a smaller, kind of more rural area of the state, and we have been able to open up transgender care. And we were not open that many days a week, but we opened up the ability on your cell phone to actually make an appointment. And my friend Ken Lambert, who runs Planned Parenthood in Dallas, he said, "Cecilia, you're not going to believe what happened. The first day, we announced that in East Texas, we would be able to provide transgender care and that folks could make an appointment. We were booked out for 2 months solid, right? The demand for affordable, non-judgmental care in this country for the LGBTQ community is so profound, we cannot block access to organizations like Planned Parenthood that
Thank you so much. Next question. How will the Trump administration's proposed changes to Title X impact the medical care and advice my healthcare provider can give me?
You start down there this time.
Okay.
I'll just take a crack at this. So great question. So Title X is the National Family Planning Program. It's a bipartisan program. Was signed into law by a Republican president. Like so many things, back in the day when actually Democrats and Republicans worked together for things like public health care. This administration is now trying to completely gut Title X. And I don't know what the latest numbers are. I think about 4 million folks, that's the way they receive their family planning or affordable family planning. I mean, my number may be a little bit off. And Planned Parenthood is the largest provider in the Title X program. So I guess two things that are really important. One is, of course, they want to block Planned Parenthood from being able to participate in the family planning program. And I think, as my friend Ruth said, it's really no use to have an insurance card or access to a program if there's no healthcare provider in your community that actually you can go to. And that's one of the reasons why it's so important to be able to keep Planned Parenthood in the Title X program. The other thing is that this administration is also trying to now implement a gag rule, a domestic gag order. Now, I know some of you may have heard of the global gag order, which is something that is, again, a policy that when Republican presidents are in office, they implement, and then when President Obama was in office, he rescinded. But it is essentially a program that has prevented millions of women around the world from having access to family planning services, because it wouldn't allow any provider that actually even talked about abortion or advised women about their rights or provided safe and legal abortion access to participate in the global family planning program. Well, now their idea is to try to make this same kind of gag order the law in the United States of America. It is un-American. it would prevent so many providers in this country from not only providing access to safe and legal abortion, but even advising women about their rights or telling them where they could go to access abortion services if they so needed. It's un-American. It requires doctors and clinicians and others to prevent life-saving information from your patients. It's a huge fight, but that's how politicized HHS has become, the Department of Health and Human Services. And the irony, and I'll just have to end with this last irony. When we talked about overturning Roe, that's something that people understand, that this president has said he wants to get rid of safe and legal abortion in this country, but it's way more than that. This president and this administration, they want to get rid of all access to reproductive health care, including birth control, including sex education. And we have to sound the alarm, and that's why we have to go vote this November.
So what Cecile is talking about, the Title X program was signed into law in 1973 or 4 or something by Richard Nixon. And it was based on an understanding and a bipartisan understanding that reproductive health care is health care. It's not a controversial thing. It is health care for women and for men. And I really do think that this administration and those who say that they support them on this issue are really out of step with the vast majority of Minnesotans and the vast majority of Americans who I believe understand this core idea as well. I have to just say one more thing about this. Not everybody in this room may know that the state of Minnesota has been a real progressive leader on family planning funding also for many years, and has for many years also signed into law, also by a Republican governor, Arne Carlson, has had a state family planning program, which is, yes, it's really a great thing. It has been a bulwark for Planned Parenthood and other community clinics to be able to provide reproductive health care to women and men in this state. And as you think about all the important reasons for you to get out and vote this election, just remember that Democratic Governor Mark Dayton has turned aside efforts to roll back the state family planning funding time and time again. And that is something that we would really need to count on Tim Walz and Peggy Flanagan to do. I know that they will, and this is just another great example of how elections have consequences.
These issues aren't just women's issues. These are family issues, men and women. And it's so many of us speaking out on that fact to make sure that our fellow neighbors understand these issues. I want to go back for a minute, though, on access to health care for women. Until women make as much as men, but equal work, until we have equal pay in this country, that is going to be one more barrier to quality, affordable health care in this country. Until we move forward with parental leave, paid time off, maternity, paternity services in this country, that is, again, going to be one more barrier for family planning, families in our communities. So the issue is not just access to health care from a clinic perspective. Obviously, we need to continue to fight every single day to make sure that our families can afford health care in our communities.
And to build on what Angie just said, I think it's really important to understand that when we're thinking about what's at stake with this election and how important this election is, we also have to be thinking about the disparities that we know that are prevalent within Minnesota and across the United States as well. And so when you think about what's at stake for the general population, put a lens on it for people who are living in poverty. Put a lens on it for people of color. If you're looking at Minnesota specifically and looking at the birth outcomes for African American women in Minnesota, African American women in Minnesota have the worst birth outcomes of any demographic group. And that is even when you control for educational attainment and income. And African American women's birth outcomes are about similar to a white woman who didn't finish high school. And so when you begin to think about that, what's going on here? So what's at stake for the general population is huge, but what's at stake for those who are living in poverty or those communities of color are even greater in many ways.
All right, I'm going to change directions here a little bit, okay? All right, so this question is directed to Ruth and Angie. How will you advocate for science-based sex education for Minnesota's youth?
We know when our youth are educated on sex education, we are going to have much greater outcomes, better outcomes in terms of delayed pregnancies. And as Cecile was saying, the fact that teen pregnancies are down are really contributable to the fact that we talk about sex education now and people can get good information. And so from my perspective, I want to ensure that our students are getting accurate information to ensure that we can keep those levels down. In addition to sex education, I think it's also important to think about all the other health implications that come in when you're thinking about having a pregnancy as well. I currently work with the Minnesota Organization on Fetal Alcohol Syndrome, and one of the educational initiatives that we have is really getting out not only to high school students but to college students as well to teach them about the risks of prenatal alcohol exposure. And PBS NewsHour just did a special on FASD, and they came here in Minnesota because of the work that we're doing. And the current estimates are that 1 in 20 U.S. school children have a fetal alcohol spectrum disorder. These are things that we need to talk about. And when we think about the stigma around these things and the stigma around sex education, stigma keeps people quiet, and stigma also keeps people from being able to be the healthiest possible.
This is an absolutely critical discussion. I know a lot of the discussion comes at the district or the state level on what our students learn, but when I think about it, I sort of start with the fact that, Betsy DeVos is in charge of the Department of Education. And so we need to make sure that our students, our learners, get absolutely unbiased information. And that's not the case in many of our schools, even in our own district, to be perfectly honest with you. When we're thinking about healthy sexual education, today's curriculum typically assumes that everyone is straight. Let me just put it that way. Well, my wife tells me that's not true. So we need to make sure that we're incorporating into all of our curriculums that it's a big old diverse world out there, and we need to be promoting safe and healthy relationships.
All right, thank you. Next question. Many states are passing targeted regulation of abortion providers laws and other laws that limit healthcare access. What is the legislative solution? And we can actually start with Ms. Cecile.
So I just want to pick up on the teen pregnancy and sex education thing. It just because so that folks know, this administration is actually trying to end the teen pregnancy prevention program. Okay, so this isn't like a theoretical issue, and in fact, Planned Parenthood and others have been in court suing to prevent this from happening. But it's, I mean, this is how crazy it's gotten, right? Is that like they don't want folks to have access to family planning services, they don't want folks to have access to safe and legal abortion, and they don't even want young people to have access to the kind of information and health care that could keep them healthy and safe. That's just how bad it is. That's why you got to go vote. Okay. End of that advertisement. The question about targeted regulations against abortion providers is a huge topic, so we can't possibly do justice to it in this panel. But again, this has been an effort in state by state. Again, unfortunately, because I come from Texas, I feel like I'm an expert in this because in Texas we have passed every single possible regulation that they could to prevent women from having access, or for people from having access to safe and legal abortion. The reason why we've been able to block so many of these is because we have a Supreme Court that recognized that women couldn't have to face an undue burden from accessing safe and legal abortion. That, if we have a fifth judge, like Judge Kavanaugh, will all change. And so it is all going to go back to the states. And I fear what it will mean, and I think this is what everyone has been working against and fighting against for so long, and why this last presidential election was so important, is that it will become a matter of like, your right to access reproductive health care will depend on your zip code. And your rights, your legal rights, will depend on where you live. So right now, and Texas is a good example of a state where they did pass regulations that would have shut down almost every single legal abortion provider in the state. We would have had maybe 6 clinics for the entire state. And the state did pass those laws. Folks fought back. Some of you may remember Wendy Davis, State Senator Wendy Davis, took over and a lot of us took over the Texas Capitol for days on end. She filibustered. And people continue to fight. And the case went to the Supreme Court, and we won. And that's why, in fact, abortion is available in many parts of the state of Texas. If that case goes back up to the Supreme Court, or a case similar to that with Judge Kavanaugh, it would be a completely different outcome. And so I think this effort to undermine, again, it's one thing to have a right on paper, but if you can't actually access, if there isn't a healthcare provider in your community where you can access healthcare, that's a pretty empty promise. And I think we're going to see more and more efforts at the state level, which is, of course, why we need a great state reps and great state senators to fight for women. So.
And just a quick announcement, if you're parked in the alley back here, if you can please move your vehicles, we don't want anyone towed. Specifically, there's a red Ford Escape. So if that's you, I'm gonna tip out. No one's looking, I promise. Okay, all right, and let's actually jump down here to Ruth really quick.
Oh, I was going to say, that's not my car. I think when we're thinking about things from a state perspective, because one of the things I hear a lot from people are, we need to build a wall around Minnesota so we don't become Wisconsin. And, and thinking about that from the perspective of everything from union rights and just thinking overall about issues related to health equity and things of that nature as well. And when you talk about zip code being a determinant for how healthy you are, that's the reality that we live in right now. And when you think about the ability to access health care, it's not just about having a card, it's not just about having insurance, but the question is what's available within a realistic time travel period for you to get to. And if you have to travel 5 hours to get your health care, I would argue that you don't have equitable access to health care. And so it's, as Cecile was saying, that's why it's going to be so important with this election that we are showing up and that we are voting, because we are literally voting for our lives.
There are places in this congressional district where not only do citizens only have one choice for health insurance or one choice for health care provider, I think it's just worth mentioning the special health care access issues in greater Minnesota, especially in the southern part of my congressional district. And I know I was in Wabasha recently, and I think they're down to one psychiatrist in the whole county of Wabasha. And so as we think about how are we going to make healthcare more accessible to folks, when we talk about high-speed internet, that's what we're talking about. Making access to education, making access to healthcare available to all of our communities. Not just folks who are low income, but people live in all kinds of places in this country, and we want them to be able to stay where they've grown up, where their families are, where their community is, and I think we need a special focus with respect to investment in healthcare in our rural communities.
Well, Ruth and Angie and Cecile Cecile have done a great job of really highlighting what is so important in on this issue. One, that where you live, your income, whether you're a person of color or not, should not be what determines whether you get good access to health care. And it shouldn't determine your health outcomes, which is really what's happening. Angie raises a really excellent point about how there is great inequity in access to health care in rural parts of this state. And we have to do something about this. I have been working hard on this in the Senate to figure out how we can get more providers in rural areas of all kinds, how we can make sure that we've got providers who want to work in rural health care. So this is a really extremely important issue. And then I want to go back to how Cecile started and really hammer this home, because if the attacks on women's rights to safe and legal abortion are going to come by undermining access more likely than they're going to come by just overturning Roe versus Wade. And we can see this in the legal cases that are lined up to come before the Supreme Court in the coming months, including a case which would make abortion illegal after 6 weeks of a woman's pregnancy. Now, I don't know about all of you guys, but you barely know that you're expecting a child. You're pregnant at 6 weeks. This is a clear effort to try to undermine access, and that's what's going to come before the Supreme Court. And it is why, God forbid this were to happen, what happens in state legislatures and with governors is going to be so extremely important, because that is where that's where this battle is going to unfold, and it's why electing Ruth is going to be so important.
All right, so we have come to our last question, which is twofold. How has access or lack of access to health services affected you in your life? What can we do to help stop attacks on access to affordable and quality health care?
So, look, I've led a very privileged life. I've always had health care coverage. I had a family that was able to get me to the doctor. So for me personally, it hasn't been an issue, but I worked for years, even before I worked for Planned Parenthood, I organized women that worked in the garment industry, women who worked in the hotel industry, women who worked in nursing homes, who didn't have health care coverage. And I've seen at Planned Parenthood, I see it every day, millions of people who come to us and say, without you, I wouldn't have anywhere else to go. So all of the conversations that we've even started here these are not theoretical issues. These are issues of lack of access to affordable health care that affect people every single day in America. It's outrageous to me that women's health care, which we used to be a leader in that, we are now 62nd in countries in access for women's health care. That's unacceptable. And unfortunately, it's not because we're not smart about health care, it's not because we don't have great medical providers and great medical schools. It's because we haven't prioritized it as a country, and because we have people in office who don't believe that health care is a right. And so I wish there were a simpler answer, but the truth is, who's in office is the single most important fact about whether that will influence whether or not people have access to health care. And as you said, it's at the state legislature, it's at the state senate, it's at the governor's office, and it's absolutely right now in Washington, D.C. All the issues that we've talked about, the issues that I hope Angie gets to vote on as a new United States Congresswoman, I cannot wait for that. The issues that Tina has already voted on. Tina was one of the folks that helped us fight back against the defunding of Planned Parenthood and the overturning of the Affordable Care Act. All of these issues are on the precipice of being decided in the next few months, and this November is the whole ballgame. So if you weren't already motivated before today, I hope you use it today. Early vote started today. There's not a single reason why we can't spend every single day between now and November 6th getting every single person we know out the polls and vote and change the direction of the state.
our mind that the number one thing that we can do to address this issue of access to health care for men and for women is for us to vote this November, or vote tomorrow, or vote the day after tomorrow, and vote what matters, which is making sure that people have access to health care. Now, like Cecile, I've been blessed. I have always been able to have my health care needs met. But I can tell you, in my work at Planned Parenthood, my work in the mayor's office in Minneapolis, my work as chief of staff for the governor, as lieutenant governor, and now as senator, I've talked to so many people who are struggling to achieve that, even if they have health insurance. Now, I've spoken to I'll never forget when I had a cattleman come up to me in greater Minnesota and say, you know, my wife has cancer. Her cancer was in remission and it has come back. And the provider that she needs to see is so far away and now out of network that she can't see that same provider anymore. But this is the doctor who's been taking care of her for 10, 15 years. And it's going to cost my family $20,000 in order to achieve that care, even with health insurance. I mean, that's just outrageous. Now, I've talked to a young mom who is 34 years old. She was an Olympic level athlete, and she was diagnosed with lung cancer. And it is costing her, if she didn't have insurance, it would be upwards of $60,000 a year, paying for the medicines that stabilize her in her disease. That's ridiculous. I've talked to a man who's lived with an HIV. Same situation. It is the cost of healthcare that is making healthcare not accessible to people. And this is a problem that we can solve if we put our minds to it. And that's what we have to do when we vote in November.
I already mentioned that I grew up many times in our lives. We had health care intermittently when I was growing up in our family. And I truly will never forget the box of bills that piled up on the kitchen table when my little sister had to go into the hospital and my mother had to call each doctor, and the hospital and negotiate and write a small check every month for years. You can't do that in this country anymore. They just have a collection agency call you and you go bankrupt. That's what happens in this nation today. You know, looking back, it shouldn't surprise me that I ended up going into healthcare. In fact, part of my role at St. Jude was to run the St. Jude Foundation. So I got to hand out money to agencies to support especially low-income women who needed cardiac care and also pediatric cardiac care. But it's not good enough in this country anymore. It's not good enough that we have to tell some women, we're going to make sure your heart's taken care of. And first of all, we need to listen to women. When they have a symptom, listen to their symptoms and listen to women. It is different in this country. Understand the differences. But access to health insurance is not access to care. No one understands better that if you can't afford health care, you can't have it in this country. And as Tina said, we have got to make health care more affordable, and I look forward to fighting that fight with you.
So I come from a long line of people who have struggled economically. My grandfather used to joke that we weren't poor, we were po, because we couldn't afford the O and the R. And my family, they were sharecroppers, and anyone who's familiar with that system, the sharecropping system is one that just sort of tied you into a system of poverty. You could work the land as hard as you wanted to, but at the end of the year, you always owed more money than you were able to make. And so you were stuck as long as you were in that sharecropping system. And there were no healthcare plans with that sharecropping system. You were on your own. When my parents made the decision to move to Minnesota, they came here because they were looking for economic opportunity. And I grew up in a large family with 4 brothers and 3 sisters and 3 siblings with disabilities. And I saw what happened when there wasn't access to care because we didn't always get the preventative care that we needed. And I saw what happened when you try to ration medication. Those are things that stick with you. But I was also the first person in my family to go to college, and I worked 3 jobs to put myself through law school. And this is the first generation of where we can say our kids actually get access to preventative health care. And that is a perspective that I want to be able to bring to the state legislature because people need to understand what is really happening for families, and we need to ensure that there's equitable access to health care in our communities.
Thank you, everyone. Let's give another round of applause to the amazing panelists. Thank you. Thank you so much. This is such a rich time.